Up next, we have another power-packed keynote presentation by our platinum sponsor, Philips, on how telehealth can impact the quadruple aim by Mubarak Al Shardan, business leader, healthcare informatics, Philips, Middle East, Turkey, and Africa. I welcome you, Mubarak, and the stage is all yours.
Thank you very much, Satish. Welcome, everyone. I hope my voice is heard. My name is Mubarak Shardan. I'm pleased honored and to present to you how the impact of telehealth on the quadruple aim. I'll go, and usually I would like to start with an important quote from His Royal Highness Prince Mohammed bin Salman, the Crown Prince of Saudi Arabia, Deputy Minister and Chairman of SIDA. He's always driving and this vision for all of us in 2030, and he mentioned that we are determined in building to build a thriving country which all citizens can fulfill their dreams. And also he mentioned that they want to focus in education, training, and high quality services, which include the healthcare. And maybe once that has been established or showed the Vision 2030 to all of us, as Saudi, we started doing a lot of infrastructure. And I'll take you in a quick brief about a study that we have done it in Future Health Index in 21 about the healthcare leaders, how confident are they of their country, and how confident are they in their hospital. And you can see the percentage in the orange that it's 99% we believe in the vision of the healthcare of the country, that we are hitting almost 100%. And same thing with the people within their organization, that also above the other 14 countries has been conducted in this study. How I heard of what in the previous few slides or sessions about virtual care, and also I praise Dr. Hani for the effort that they have done in the virtual hospital or Sahha hospital. But how it's not only being that to serve people at home, also, and you have seen a couple of examples that it's diagnostic at the patient at the point of care, so you can consider the patient wherever they are, and the image here showing a tele ultrasound in an ambulance. Also, the clinical and operation center, we have a lot of examples here that also applying the role of 24/7 operating departments, even outside of the walls of the hospital, with having different resources across the country or across the world. But also we think about the patient, and we look at the patient from the prevention as shared by Dr. Tamara in the previous session, and at their home, prevention before the invention. The slide is one of the, maybe I can start with it or end with it or talk a lot about it. This is where we can talk about the quadruple aim. It's been talked a lot before the pandemic, increased a lot in the during the pandemic and post-pandemic. It should be focused in every single initiative within the healthcare organization. We, of course, as healthcare providers and practitioners, we want to have better healthcare outcomes for our patients, but also we want to improve their experience. We don't want just to treat them, give them the medication, but also we want to have their experience is going in a different level. But heard a lot about the burnout, and the staff experience has been really challenging in the past 2 years, especially after the pandemic. All the patients that they couldn't do this elective cases, now they are going back to the hospitals, increase the waiting list, increase the load on the practitioners. And all of that, it comes on a cost, and it start to increase over the time. And that's where we want to focus on how can we lower the cost of care. And all of this has been addressed in a couple of initiatives in the telehealth. A lot of investors, healthcare decision makers, key opinion leaders thinks telehealth will just lower the cost of care, but also it improves the staff experience. It improves the patient experience. And also it increased the healthcare outcomes by being very close to the patient. And I'll show you here a couple of challenges. It's only, I think, 10 here in the healthcare today, but there are a lot more. If you are working in a hospital, in management, in corporate, in any healthcare organization, I'm sure you will address at least one of those. Highlighting here a lot about radiology exams. It is increased by 43%. Also, we're expecting the demand of the healthcare storage or data that it will reach more than 2,000 exabyte in 2022. Yeah, the year is not 100% accurate, but we expected this year. Also, shortage of radiologists, and also that's applied in a lot of other specialties like histopathology. We have a lot of workforce shortages. All of these has been addressed in the different organization, and we can go in one example about how did we address that together with our partner, and how is it serving now their needs. This project called TAGI, and which is telecardiology network, and it is serving 7 Ministry of Health hospitals. Started in 2018, and it's been 100% utilized in during pandemic, supported our partner Ministry of Health in achieving their goal. And I saw the number from Dr. Hani that 700 consultation has been done with the National Heart or Cardiac Committee of Saudi Arabia. The concept of it, it's not just we build it and thought about the command center concept. We started actually with considering the pain, the current challenges, which is the digitalizing the hospitals. And from that angle, we moved ahead in order to achieve the telecardiology consultation among hospitals and have the subspecialized consultants based in one place, and they provide their consultation to other customers or other hospitals. But it's not limited for teleradiology or limited for telecardiology. Also, there are a lot of other solutions that applied in the healthcare domain that also will support achieving the quadruple aim. I'm highlighting here 4 of them: eICU or tele-ICU, and we are seeing a lot of demand and burnout of the consultants or intensivists and people working in the tele-ICU. We saw how really needed to have an ICU bed during the pandemic. Having a solution like this, it will apply and allow intensivists to have one view among more than one bed, because the system will support them identifying which the patient needs to have focused more through our AI algorithms that built within the system. Also, tele-ultrasound, which is quite challenging because ultrasound is a mix between the knowledge of reading the image, but also the hand skills. And this is tele-ultrasound, which allow the practitioner, sonographer, or whoever else from paramedic, that they can use the probe or the ultrasound transducer and work it out or do the procedure from distance, and also been guided through a video streaming from the radiologist who's sitting in a command center or a reading center. Same thing applied for the early warning system, where we can capture a lot of data and highlights the abnormalities that going above the threshold of our readings. And last but not least is the digital pathology, where we can utilize the old microscope way of dealing with the slides into more digitally powered by AI, which allows all of the histopathologists to read and support, and the tool will support them in counting the abnormalities in the readings. Showing here also how we consider through the Future Health Index that how is the young and newly joined practitioners and profession, that how are they seeing the telehealth will support them in their work. So you can see in the middle that latest equipment and technologies has been considered by a lot of people in order to be more efficient in their work, and that's also assuring the maturity of the newly generation or the new generation about the concept of the needed of the technology. And one of them, of course, is the telehealth. But of course, we as Philips, we cannot do this alone. We do it also with a clinical transformation. And a lot of clinical transformation also could be provided by vendors but like Philips, but also believing in the organization that this change or this transformation is needed is also important. It's not about only bringing the technology, but also understanding that this technology will support the organization in using it and taking them to the next level. Same thing applied for the strategic thoughts about how do we do it, because we really need to think about where are we standing now and how we want to be in the future. Admitting the current challenges is the first solution. It's not about having a fancy monitors, but the out of it is not used or addressing the pain of the organization. It should be considered closely together with different stakeholders, different departments, and think about building that strategy together. And maybe ending it with a slide from, again, His Royal Highness Prince Mohammed bin Salman, where he mentioned that it will adopt the principle of value-based care, where we, of course, he looks also the outcome of the healthcare system that ensures transparency and improve health services to contribute to raising the satisfaction of beneficiaries. And if you see this paragraph, it actually summarizes the entire quadruple aim. Thank you very much. And I will leave it for question and answer if there is any.
Well, Mubarak, we don't have any questions as such right now, but if we have any questions, I will definitely email it to you.
Thank you very much.
Thank you, Mubarak, for your very insightful presentation. It was valuable, and thank you for sharing your thoughts today. Do enjoy the rest of your day. In the meantime, I would urge all our participants to visit our prestigious platinum sponsor, Philips booth, to explore their world-class healthcare solutions for your respective enterprises. Please feel free to drop any questions in their booth, or you can have a chat with one of their representatives.